Well, Vincent, I want to highlight our telehealth services a little bit because I think one of the things the COVID pandemic has done at St. Bernard's and really nationwide is sort of push us to move more into that realm than we already were. It sort of expedited us getting into that, and I think we were able to utilize those services in a great way. And one way I'll say, just in talking about visitors. We were able to use iPads in the ICU for patients to be able to visit with their families, and we would set that up to do that regularly. And that's just one little piece. You've got a whole lot of other things going on, but if you would just talk about how we sort of utilize those services during the pandemic and what our plans are really moving forward, that the pandemic may have spurred us to move into.
As we were very fortunate that, a few years before COVID, we had started to build our telemedicine and telehealth infrastructure. And so we had a lot of things in place, not just here in Jonesboro, but also throughout the region of our other hospitals. There were times we didn't know exactly what we were going to be doing with all the devices, but we knew we had them and they were in place, ready to, be active. And then COVID hits, and you quickly figure out how you can put them into use. You quickly, we had, physician adoption. That's difficult, getting nurses on board, getting the other administrators of these hospitals on board. So COVID accelerated all those decision-making processes for us and helped to be able to now put into place the strategy we knew we were going to have but didn't know exactly what it looked like. It allowed us to make it operational. And so as we're able to provide physician coverage and support throughout the region, in the homes for patients in the community, we've been able to now fully adopt those models and now know going forward that we're going to be able to use these same devices to complement what we do in the clinic and in our medical center settings. Telemedicine and telehealth, digital health, it's not replacing healthcare, but it's going to be another tool for us to be able to provide access. We have a lot of people that are, like, say, example, if we've got a patient who's at Five Rivers Medical Center and, we've got a bed crisis here in Jonesboro and that patient can't come from Pocahontas, but we're able to still get a physician to be able to see them in the hospital. So those are things that we were able to see during COVID and now be able to put in place and make it operational.
So I think we've got some exciting things coming in that regard too, just to be able to keep people in their home and receive health care there, not having to come into the emergency room, into the hospital. So I'm really excited to see some of that come to fruition.